Happy Friday, Cumberland County. My name is Renee and I am the Executive Director at the Sexual Health Center and your sexual health educator for the county. For this week's video, we made a handy dandy list for you on things to remember to do before doing it. And of course, by it, we are referring to sexual activity of all kinds, including oral sex, anal sex, and intercourse. It's important to be both physically and mentally prepared before engaging in sexual activity. The first question that you're going to ask yourself is, do I want this? Are you ready for this? And is this something that you want to do? If you've decided, yes, this is what I want, you next need to ask, do they want to do this? You need to obtain consent before you go any further with sexual activity. Do you have your partner's permission? Are you under the influence of alcohol or drugs? It is important that you're both of clear mind and have made the informed decision that you want to have sexual activity. So it's also important to communicate with your partner about any STIs that you may have contracted, and to make sure that you've been to your doctor to be checked to make sure that you don't pass anything on to your partner or to anybody else. It's also important to keep in mind that your personal hygiene does matter. We don't want any germs to be spread. You want to also help to boost your self-confidence as well by maintaining great personal hygiene practices. But I bet you didn't know that while it's okay to have a breath mint before sexual activity, I do not advise you to brush your teeth before sexual activity. Brushing your teeth can actually cause your gums to bleed, as can flossing, which can help to increase your chances of receiving or transmitting a sexually transmitted infection to your partner. So don't worry about the toothbrush, but feel free to use that breath mint. Next is that you do not want to use a douche. Do not douche. Do not use any of those scented wipes that are on the market right now. You do not need these products. Your body does not need these products. These products can cause infection and irritation that is not going to make this experience pleasurable for you now or into the future. You also want to pee before and after sexual activity, specifically intercourse. By peeing before sexual activity, you are actually going to significantly decrease your chances of getting a urinary tract infection following intercourse. So, once you've maintained some of your physical upkeep and that you have consent, you do want to make sure that you have supplies on hand. You do want to make sure that you have condoms and plenty of lube, because lube is your friend. I often get asked, whose job is it to carry the condoms? Is it the woman's job? Is it the man's job? And my response is, it is everyone's job. Nobody is going to take care of your body better than you are. So always make sure that you are prepared, whether or not you are planning to have sex tonight, this weekend, or maybe even a couple of months from now. Always better safe than sorry. So, once you've communicated with your partner and you feel physically prepared, it's important to relax, to help to set the mood and get into it, and to have some self-confidence. Maybe give yourself a little bit of a pep talk, give yourself a little talk in the mirror beforehand. You got this. You are going to rock this. Nothing wrong with little pep talk from time to time. Remember, here at the Sexual Health Center, we want you to be healthy and to be safe and for you to have fabulous experiences. And most importantly, if you're going to undress, protection is best. Thanks everyone, and have a great weekend.